So with that, I'll open it up for questions. For those of you interested in a book, my latest book, Functional Nitric Oxide Nutrition, I encourage you to follow me on Instagram. There's my YouTube page. And those of you interested in the product technology, the URL's up top. So with that, Michael, thank you very much for the opportunity, and I hope this has been informative.
Yes, it definitely has. And thank you so much for sharing all of that information. And thank you for sharing how people can get your book as well as follow you. So for anybody who'd like to ask Dr. Bryan any questions, you can raise your hand in Zoom. We'll put how to do so in the chat. We don't take questions directly from chat. So if you do want to ask a question, please raise your hand. So actually, the first question I was going to ask is, how is your work being received? And you spoke to that. Do you see anything that you're optimistic about with people responding to your work? Is it starting to absorb, is it starting to penetrate with some of the medical profession? Are people putting this into practice at all?
Yeah, my main objective today is, I travel, I give 30 to 40 lectures a year around the world, and really it's to educate and inform on nitric oxide. So one of my greatest joys and the gratifying things that I do as I wake up every morning, I have hundreds of emails, texts, or phone calls of people that we've changed their lives. And these are either from physicians who have given their patients the product or consumers who have bought directly and kind of, taken their health into their own hands. But to answer your question, yes, we are penetrating. People are starting to recognize how important nitric oxide is and finding our products that actually work. And we've got a number of clinics, hundreds, if not thousands, of physicians who now use this product technology in their daily practice, and it becomes part of their protocol. If you're seeing these docs, then part of their protocol and being a patient in their practice is compliance. And so part of what they're doing is you start on the nitric oxide, kind of level the playing field, improve circulation, mitigate the inflammation. And now that allows the physician to dig a little bit deeper and get to root cause of what other ailments they may be experiencing. Because if you don't first correct the nitric oxide deficiency, a lot of their other symptoms will simply be masked by the nitric oxide deficiency.
So are you saying that people need to use these products? They won't be able to regain their nitric oxide production without them?
Well, understanding how physiology and biochemistry works, in a perfect world, in utopia, we can just give the body what it needs and remove from the body what it doesn't need, and the body heals itself, right? Medicines and doctors don't heal patients. Cells heal patients. So we just got to mobilize and repair and replace dysfunctional cells. But the truth is, the food that we eat in America is depleted of most nutrients. And most of the food is sprayed with herbicides and pesticides. And then we're exposed to environmental toxicants like fluoride, like glyphosate, like 5G. All these environmental toxicants are interfering with normal biochemistry and physiology. So it's almost like we have to supplement to a certain degree and basically enhance the body's ability to overcome all these limitations that we're exposed to. But I tell people there's only two types of people who need nitric oxide. There's the people who are sick who want to get well, and there's the people who are well and don't want to get sick. So if you fall in one of those categories, then obviously you need nitric oxide. And I'm probably the best example of that because I've been doing this for 20, 25 years. I'm 50, but I have the biological age of a 32-year-old. And it's because I focus on my nitric oxide production, and I'm on an airplane every week. I'm in and out of hotels. I'm in different countries, exposed to different foods and cultures and pathogens. But yet I haven't been sick in more than 25 years. I haven't lost a day of work due to illness in 25 years. So I think that works. And I think medicine today is a reactive practice, right? People don't take action until they have a heart attack, stroke, or develop disease. We want to change that narrative and start to recognize symptoms that are signs and symptoms of nitric oxide deficiency. All of us have this smartphone. And when the red light comes on in the corner saying we're about to lose charge, we panic. We drop what we're doing and we go charge our phone. I mean, we have red lights that come on all the time on the human body, and yet we ignore it. It's erectile dysfunction. It's an increase in blood pressure. It's metabolic disease. It's loss of memory. Those are red lights telling us, hey, something's going on. If you don't pay attention, you're going to die. And that's where, again, nitric oxide is not a silver bullet, but we have to first focus on that, lay the foundation, and then do all the other things that we need to restore cellular health.
Are you familiar with the work of Dr. Caldwell Esselstyn at all?
Yeah, look, I've had many conversations with him, and his data are indisputable in terms of reversing cardiovascular disease in patients and keeping patients from bypass surgery, or even heart transplant by putting them on a plant-based diet. And obviously he's published on this, but the conversations we've had is he goes, Nathan, he goes, I see this and I don't have an explanation why some people employ this plant-based diet and see perfect reversal and regression of disease. Some people you put on a plant-based diet and they don't see any effect. They don't get better. And I go, well, are these patients using mouthwash? Are they using fluoride toothpaste? Because if they're killing the microbiome, they're never going to get activation of a plant-based diet into nitric oxide if they're using mouthwash or fluoride. And he goes, I mean, it was like the light went off. He goes, holy shit. I guess I've never asked my patients that. Like, well, now you can interrogate your patients. And as I mentioned before, 10 out of 10 people are going to say yes to fluoride and 2 out of 3 people are going to say yes to mouthwash. That's just in the US. So get rid of fluoride, get rid of mouthwash. Now you can actually see the benefits of a plant-based diet because the body can actually convert it into nitrite and nitric oxide and lead to plaque regression.
And I know that in his books, he writes about reversing the damage to the endothelial lining, and he specifically discusses nitric oxide as being the benefit of healing the endothelial lining and getting things to flow. So now I noticed in the slide that you put up with the comparison of the diets, there wasn't a plant-based diet there. It was a vegetarian, which often has a high degree of animal products. Has extensive research been done and the comparison with whole food plant-based diets compared to these?
Well, that was kind of the objective of that cross-sectional study with the vegetables, where we just took 5 vegetables across 5 different cities across the US. But it's difficult, if not impossible, to know if you're getting enough nitrate from your diet. And so the other problem is when you cook these, and the way we do the extractions in the lab is we actually boil these vegetables. So if you're boiling your asparagus or your spinach or your vegetables, you may be better off drinking the water in which you cook your vegetables in than eating the vegetable, because all water-soluble nutrients come out, right? So what we're finding is that raw is best. It preserves what's there to begin with, but what may be there to begin with may be insufficient. And so raw is best, steaming or baking kind of preserves it, but cooking them in water is how we actually do the extraction to determine how much was there to begin with.
And you talk a lot about the microbiome. You talk about avoiding mouthwash. The other night during our panel, we were discussing Michael Greger's video on tongue scraping, and you informed me that actually he was talking about your work. Can you talk about tongue scraping and why tongue scraping has the impact that it does while brushing your tongue doesn't seem to?
Well, tongue scraping is an ancient practice that goes back to Ayurvedic medicine and some older cultures. And so I equate this to similar to tilling the soil or plowing the soil before you plant a seed. So tongue scraping actually gets into the crypts of the tongue. And so the bacteria that are responsible for producing nitric oxide are what's called facultative anaerobes. They're typically deep in the crypts of the tongue. So if they have oxygen available, they'll utilize oxygen to respire. If oxygen is not available because they're in this anaerobic biofilm, then they'll use nitrogen as a source, and that's kind of this flow of electrons of reducing nitrate to nitrite, nitric oxide. So what tongue scraping is doing is it's kind of plowing the soil and opening up these crypts, and now you're kind of destroying the biofilms and allowing that biofilm to recreate in a more healthy manner. So what we see in tongue scraping is you improve the diversity of the microbiome, and you're basically constantly tilling the soil, aerating it, and then allowing for this change in ecology. So tongue scraping itself is good, but in our 2019 paper where we referred to tongue scraping, in the patients that were tongue scraping and used mouthwash, those were the conditions where we saw the greatest increase in the blood pressure. So if you do tongue scraping, you open up the crypts and you use mouthwash, now that chemical antiseptic can penetrate deep in the crypts of the tongue and you get better effective killing of the microbiome. And now that's when you see the great increase in blood pressure. So I encourage people to use tongue scraping, but never use tongue scraping and use an antiseptic.
And why doesn't brushing work the same way that tongue scraping does?
Well, the bacteria on the dorsal part of the tongue are near the gag reflex. So what we encourage people is tongue scraping, because you're applying mechanical pressure and actually getting back there, hopefully without gagging. And with toothbrush, whether it's, an electric toothbrush or whatever, you're the bristles aren't going to penetrate as far as the mechanical pressure from that tongue scraping. And two, some people get too far and they gag and then they basically give up on, on brushing their tongue. And two, if you're using a fluorinated toothpaste, then obviously you don't want to brush the back of your tongue because you don't want to introduce that fluoride into the crypts of the tongue to effectively kill the guys that would otherwise be, there'd be a barrier to that fluoride to reaching those bacteria.
And when you do that, and I'll be honest with you, after our discussion last week, I went out and I bought a tongue scraper. When you're using it, how far back do you go? Is there any special technique, or you just kind of clear off the biofilm and you're good to go?
On the tongue scraping?
Yes.
Yeah, so what I do is I'll typically do 1 or 2 scrapes, and you'll see it. I mean, the kind of the stuff that comes off when you do that. But I'll do a tongue scraping and then kind of rinse it off and then go back and maybe try to get areas where I didn't get the first time. But yeah, 1 or 2 scrapes once a day is typically sufficient.
So you spoke about 2 Chinese herbs working synergistically with each other. I don't know if you named those herbs. What are those herbs?
Yeah, we didn't name it in the paper we published, but this was Dan Shin along with borneol. So the Dan Shin is an herb that's been used throughout traditional Chinese medicine. It's probably the mainstay of these herbs. But when you combine it with borneol, which is a crystalline salt, I think it's called bing ping in the traditional Chinese pharmacopoeia. But it's the work together that create energy.
Okay, great. And let's see here. I'm going to throw a couple of questions out to the audience. Jean D, please state where you're from and ask your question, Jean.
Yes, I have a question. Is there what is the latest scientific information about pulmonary fibrosis disease, the cause, and anything to reverse or cure?
Yeah, I mean, there's different causes for pulmonary fibrosis. I mean, we've studied this in animal models, and it's kind of the end stage disease of any pulmonary disease. It can be idiopathic pulmonary fibrosis, which means the fibrosis occurs with no real reason. There's exposure to things like asbestos and mesothelioma that will lead to pulmonary fibrosis eventually. So again, it goes back to these basic principles that all human disease is caused by 2 things. Your body's missing something that it needs, or it's exposed to something that it doesn't. If you don't remove yourself from exposure to asbestos, then nothing's gonna make you better. So to answer your question in terms of kind of overt disease or diagnosis of pulmonary fibrosis, we've got in one of my first slides where I did the disclosures through Sage Pharma, we've got a class of drugs called G-SNO reductase inhibitors, and this is completely different than what I'm doing, but I'm on the board of this company. But it basically potentiates nitric oxide signaling. And in animal models, we see really good reversal of pulmonary fibrosis. So if you look up in the published literature, and these are animal studies, so preclinical, it seems that if we give nitric oxide, we can mobilize stem cells, we can remodel the lungs and reverse the pulmonary fibrosis. But again, if you don't understand what led to the onset and progression and the end disease that's consequent to them, then there's nothing that's going to be able to fix it. Maybe we can help to slow the progression, but until you move yourself from the source of exposure that caused disease and then replace missing nutrients to the body can actually mobilize stem cells and heal, nothing's really going to work.
Thank you. And you mentioned fluoride as being something to avoid in toothpaste, and a lot of the toothpaste that don't have fluoride have xylitol. Does xylitol have any negative impact on the oral microbiome?
Probably not surprising. There's 2 camps in dental medicine on xylitol. There's some who swear by it, who use it and want to use it. Then there's the camp that's the complete antithesis of that. They say you should avoid xylitol. It causes dysbiosis. So and that's just, I can't comment because we just don't have the answer. In terms of, there's plenty of data out there on xylitol, but we've never characterized xylitol on the effects of these nitrate-reducing bacteria. So what we do is, we just need to do the experiment and figure out exactly if it's affecting the oral microbiome. But to date, I don't have an answer.
Great, thank you. Next question is coming from Elaine W. Please state where you're from and ask your question. Oh, hold on 1 second here. Elaine.
Hi, sorry, this is Elaine from Iowa. I have a question on 2 different cancers. Multiple myeloma, which they often use stem cells as treatment, Could increasing nitric oxide benefit those patients in terms of stem cell harvest? And then the second question is around patients using Cialis, losartan, those types of drugs to open up the blood vessels in their tumors to increase the efficacy of chemo. Could nitric oxide benefit those patients as well? And final rapid fire questions. Is ADMA a good tracker for nitric oxide? Yes or no, as a biomarker? And have you tested Calroy products which use green seaweed? Thank you.
Yes, I'll take them one by one. Multiple myeloma or bloodborne cancers are typically always induced by some chemical toxicant, whether it's benzene or organic chemicals exposed to in your work environment. So what we're finding is that lymphoma, multiple myeloma, leukemia, you have to identify the chemical toxicant. And so until you remove that from the body, and you can do this through organic testing, you can do it through different labs in peripheral blood, then the multiple myeloma is never going to resolve. But obviously, if you can mobilize stem cells and replace those diseased or cancerous cells, which depend upon the ability to produce nitric oxide, then it can help. But again, until you remove the source of exposure, what caused the transformation of the blood cells, then there's never going to be a cure. And that's the frustration with oncology is the cancer docs never ask, why did you get this cancer? And how can you treat something that you don't know the cause? And that's why cancer patients, the field of oncology is still the wild, wild west. They treat cancers the same, surgery, chemo, and radiation, without any regard to the cause of the cancer. So I think if you can mobilize stem cells with nitric oxide, you can replace those transformed cells. But if you haven't eliminated from the body what caused the transformation in the first place, you're chasing your tail. The next question was on Viagra and losartan and all these to open up the blood supply of a tumor. So primary tumors are completely different than bloodborne tumors. Primary tumors, from my experience, are always caused from an infection, and 90% of it comes from a dental infection. And so cancer is very unique in the fact that it controls its own blood supply. So cancer cells can only operate and grow in a low oxygen, low pH, low voltage environment. And so we did this probably 15 years ago, where we were developing liposomal or nanoparticle delivery of nitric oxide gas with chemotherapeutic agents. So the strategy was, if we can get to the hypoxic tumor, the primary tumor, and then open up the microcirculation that's feeding that tumor, we can selectively deliver that chemotherapeutic agent to the rapidly dividing cancer cell. The preclinical data, was somewhat promising, but it's never been able to translate into human disease. But again, I think nitric oxide is critically important in metastatic disease. Number one, you have to figure out what caused the primary tumor. Did that patient have root canals? I'm finding that 90% of patients with primary tumors can be traced back to a root canal in several teeth. So you have to, again, address the root cause of what caused that cancer to grow. This goes back to Otto Warburg in the 1940s. It's the Warburg effect. It's aerobic fermentation, uncoupled mitochondria, and all the low pH, the acidic, low oxygen, low voltage environment. If we can overcome that, recouple the electron transport chain, superoxygenate that tissue, then by all accounts and by all metrics of cancer biology, the cancer cell can't grow and can't proliferate.
So,
and then the Calroy product, I'll answer the third question.
Sure.
Yeah, the Calroy product, look, there's good people in these companies, and I have a lot of respect for the people at Calroy, but just their strategy is different than what we do. So they got two products. One is the glycocalyx, where they use the seaweed to kind of restore the glycocalyx, which is the protective layer on the endothelial cells. The glycocalyx is extremely important in protecting the endothelial cells. But if you restore the glycocalyx, but you don't restore the function of the NOS enzyme, you still have an improved endothelial function. So they're two completely separate organisms, and they have to be addressed separately. So what I like is the Calroy glycocalyx product, because it does something that my products don't do, but yet my products do something that their products don't do. So I think it's a perfect combination of restoring the function of the glycocalyx, which protects the endothelium and creates this cell-free zone and protects from shear stress of damage to the endothelial cells.
So I guess it works in combination, kind of like the Don Shin and the Borneal.
That's right.
There you go.
Absolutely.
So you mentioned root canals being something that you've seen cause issues. Is that because of the cavitations? We've had a
Well,
couple of dentists speaking on cavitations and the bacteria that grows within them. Are those contributing factors?
yeah, so the teeth are like the circuit breakers, we're electrical beings. And this goes back to the acupuncture meridians that date back, thousands of years in Eastern medicine. So the teeth, all the electrical voltage and circuitry goes through the teeth. And so if your tooth has an infection, then it disrupts the flow of voltage. So just like if you trip a breaker in your house, the electricity goes off in that circuit. And so when you decrease the voltage through that circuit, then that organ that's tied to that tooth, and every organ in the body is tied to a specific tooth, then you shut down the voltage, you shut down the pH, you decrease the dissolved oxygen, you uncouple the mitochondria, and that sets the stage for cancer cell growth. So what is it about the infection? Number one, they're anaerobic bacteria that are utilizing and breaking down your bone. And then when they do that, they metabolize this. And so you release toxins in that. So now you become toxically burdened and you're shutting down voltage. So what you have to do is you have to extract the diseased tooth, and then you have to go in there and actually kill the infection. And you can't do this with like irrigation or an aqueous antibiotic, because the tubules in the teeth and the bone are too small and the surface tension of water is too high. You can never penetrate into the bone to actually kill the infection. So what a lot of these dentists do, the really effective dentists, is use ozone gas, because ozone gets into the tubules of the jawbone of the tooth and completely kill the anaerobic bacteria. So yeah, there are a lot of things. And in fact, oral disease and asymptomatic root canals are really driving a lot of poorly managed chronic disease today, because nobody ever looks in the mouth. And most dentists will do today say, hey, the root canal is not a problem, but it's still dead tissue. If you leave any other dead tissue in the body, you're going to develop gangrene and sepsis, and you're going to die. Well, a root canal tooth is a dead tooth, and you may not die in a period of a week or 10 days. You'll just die 10, 15 years later from cancer.
And you mentioned getting rid of mercury. What happens if I know like there's special dentists that are SMART certified to remove mercury. Obviously, you're getting rid of mercury in the first place because it's so toxic. What happens if you don't have a person who's SMART certified and maybe they don't do a great job? How do you detox from mercury?
Well, number one, the dentist is exposed, and they're exposing their patient to the volatile nature of mercury if they're not removing this in a safe and effective manner. So mercury is a neurotoxin. Any heavy metal will scavenge nitric oxide, and in fact, if you've got a heavy metal burden, then typically you develop resistant hypertension, because even though we can replace nitric oxide or replete nitric oxide, the heavy metals will scavenge it and bind it before it has a chance to do its job. So mercury detox, I mean, there are a lot of protocols out there. Glutathione is critically important. You can do chelation therapy to bind these heavy metals. I use things like chlorella and spirulina, these algae products that can help bind metals and other toxins to clear it. So every morning I wake up and I take my chlorella and spirulina, and then I sit in an infrared sauna to help detox, mobilize toxins, and then you sweat it out, you urinate it out, you defecate it out, and you detoxify through deep breathing.
All right, we've got about 30 seconds or so. We'd like to leave the audience with any thoughts or any optimism on this message getting out to the wider world.
Yeah, we're moving our technology through drug trials. So we're in phase 3 clinical trials through the FDA. So not only do we develop, consumer products in the nutrition, dietary supplement, and skin and beauty space, but we're undergoing the rigor and the time and the investment of getting this technology through the FDA, because I think the only way this will be accepted on a global scale in medicine is to prove that this technology is safe and it's efficacious for specific disease indications. And now, once we get these drugs approved and on the market, now the healthcare practitioners and physicians can actually write a prescription for a drug that's been proven safe and effective. And again, I don't want to intermingle this with drugs that are currently on the market, because most drugs are toxic. In fact, all drugs are toxic at some level because they're inhibiting a certain biochemical reaction. What we're doing is not pharmacology, it's restorative physiology. Understand the mechanism of disease to the extent that we can fix it. We know how to make nitric oxide. We know what goes wrong in people that can't make it, and we can correct that. So stay tuned. We expect to have these drugs approved on the market in the next 12, 18 months for ischemic heart disease, Alzheimer's, and our topical drug for diabetic ulcers. And that's just the beginning. Then we'll go after heart failure, pulmonary hypertension, and many other poorly managed diseases.
Great. Thank you so much for sharing all this great information. Really looking forward to seeing what comes out of your research or bringing this product to market. So thank you. And if we can unmute the audience so they can share their appreciation for Dr. Bryan, please.
Thank
Thank you so much.
Any
Thank you.
medication or food allergies?
Thank you.
Thank you.
For